All attendees are in listen-only mode.
Welcome to today's webinar. We are going to get the slides up. Thank you, Michelle. So today we have our SHAC in action, SHACs impacting wellness change within their district. The webinar is sponsored by Texas Action for Healthy Kids, and It's Time Texas is a part of the SHAC leadership team. Today we have myself, It's Time Texas School Programs Manager, Sara Jefferson. We have Michelle Smith, Texas State Coordinator with Action for Healthy Kids and a parent of the Austin ISD SHAC. We have McKaylee Smith, PE and Health Coordinator with Comal ISD, and Sheila Gardner, the K-12 Health and Physical Education Coordinator with Frisco ISD. Next slide, please.
Is it there?
There might be some type of delay. Yep, there it goes. So logistics, if you are needing, all attendees are muted. You can submit your questions under the questions section. You'll have to click the plus button and then you just type your questions there. We'll have time at the end of the webinar to address any of your questions, so feel free to type those in. The webinar is being recorded, and you will have access to the recording as well as the PowerPoint slides that the presenters have shared with us today. If you're needing CEU credits, we will send those certificates out by the end of the month, and those will come from an It's Time Texas email. If for some reason you don't get those, feel free to reach out to us. Our contact information will be on the last slide, and we will send those over. And then in order to hear, you can either use your phone speakers calling in or your computer. Next slide, please. So our agenda for today, we will briefly cover what SHAC is, but if you're needing more details, please check out our other webinars that we've been doing monthly since last fall at itstimetexas.org/SHAC. All of the SHAC in Action Partnering for Healthy Kids webinars will be on that page. We'll also be addressing a wellness policy overview, and then we'll hear from our guest speakers, McKaylee from Comal, and then Sheila Gardner from Frisco ISD. At the end, again, we'll have those resources to share out with you, as well as the Q&A. Our upcoming SHAC webinars, as mentioned, we've been doing this monthly since last fall. We have one more for the fall, and then we'll pick up back in the spring, probably around February. But for October, we have our social and emotional wellness webinar, and so we will have experts in that field talk about why it's important, how SHACs can help address this issue, and strategies to do so. And so, again, that's the last Tuesday of the month, and we'll be sending out reminders so that you can join us for that webinar as well. We also have the Southern Obesity Summit, which will be in Houston, November 11th through the 18th. So if you're needing more information about that, please contact Michelle Smith. Again, her contact information will be at the on the last contact slide. And then in February, we have the Texas Action for Healthy Kids Summit here in Austin, and that will be held February 10th. And again, SHAC webinars, more to come in the spring of 2017. Again, my name is Sara Jefferson, School Programs Manager, and I will begin with the next slide. So really briefly, a School Health Advisory Council, we know that healthier students are better learners, and this is a district level council that assists in reviewing the health education curricula for the district. It also addresses wellness policies, as well as the physical activity subcommittee mandate. So what is a SHAC? SHACs are mandated by state law. They are members should be appointed by the school board. It's a way for parents and community stakeholders to have a voice in what's going on within the district in regards to the health and physical education curricula. And it's also a way for this group to share the importance of health, not only to the district, but to school board members who may not have a expertise or focus in this area. SHACs also review all health education curricula. They make recommendations on health-related topics, as well as the district coordinated school health plan. They also must review and recommend a recess policy for the district to implement, and review and recommend joint use agreements. We've talked about collaboration and joint use agreements in some of our other webinars. We've also talked about coordinated school health and recess policy in some of the other webinars. So if you're wanting more information on those topics, please feel free to check out those webinars, again, on the itstimetexas.org/SHAC page. So I'm not going to go into too much detail on SHAC law, but here are some of the things that SHACs need to abide by. The chair, co-chair must be a parent, and many times you have a district representative who is helping chair the SHAC with them. They must report to the board at least once annually. This could be written or in person, but we always recommend doing both, as it's really nice to get up and have that face time in front of your board. And then SHACs must meet 4 times annually. Excuse me. And this is to ensure that your SHAC is active in doing all of the things that it should be doing as far as providing those recommendations and reviewing those specific areas of need. Many SHACs meet more than those times, more than those 4 times. And then the members must be comprised of at least 5 members appointed by the school board, and 50% of the SHAC must be parents who are not employed by the district.
Oops.
The new mandate for the physical activity subcommittee, they're addressing physical activity and fitness planning. And this is all issues related to physical activity and fitness. They also should be making recommendations on ways to increase physical activity and fitness within the district. Again, we have a specific webinar on recess policy, so feel free to check that out.
Oops.
I will now pass it over to our presenters today, as they have some really great information to share. Thank you, Michelle.
Michelle Smith, State Coordinator for Action for Healthy Kids. And what I'm going to talk about today is a little bit of talking to administrators and school boards about why health is important. And the School Health Advisory Council is a key to developing wellness policies and getting wellness policies implemented in districts. So I'm going to go a little bit through some slides that will hopefully give you some ideas on how to present the case for school wellness to school administrators. One of the things that is always, I think, startling to administrators is the fact that, unless we do something, about half of the children we look at in a kindergarten class today will become obese adults. And the fact that, our children will not live as long as we will, or we are expected to, because of health issues like diabetes, heart disease, stroke, and cancer, usually we'll start the conversation and get a little bit of attention from school administrators. Another thing that has made an impact, in fact, this was something that impacted the State Board of Education when I presented to them, was the fact that a lot of our young men that are trying to go into the military are being rejected because of overweight or obesity. And that's the primary reason that they can't join the military, which has a direct impact on protecting the United States. One of the things that I think makes the biggest impact with school administrators is when you talk about the bottom line. So in Austin, we did an analysis of the cost for children missing school because they were sick. And so we did this little chart, this little formula. And if you know what your district rate for absence is, ours was $45 a day. Children on an average miss 12 days or 10 days of school, and obese children miss 2 more days than that. And so adding it up, we ended up discovering that it was costing Austin ISD millions of dollars for the absent children. And when you start talking about that much money, then they start thinking maybe we do need to pay a little bit more attention to how healthy our children are and spend a little bit more time on keeping them healthy and keeping them in school. Another thing that makes an impact is showing things like these slides, these brain slides, which are showing the activity in the brain after 20 minutes of walking versus sitting quietly. And this was part of a study done by Hillman that showed the students who were sitting quietly and then took a test versus the students who had a walk before the test. And the differences were the students who had the walk finished the test more quickly, had more correct answers. So those type of things, when you connect the academics to health, also is something that will help you convince your school administrators that they really need to be paying more attention and making sure that their wellness policies are having an impact. Again, undernourished children tend to have low energy. They act out more in class. They have a harder time staying focused. And there are also studies that show lower scores in vocabulary, reading, comprehension, and arithmetic. A lot of this information you will find on the Action for Healthy Kids website, or if you Google the Learning Connection, we basically have a document that you can download that has all the statistics and even has the brain map slides in there as well, and is something that you can share with your school administrators. Each school district is required that is participating in the school meal program is required to have a wellness policy. The Healthy Hunger Free Kids Act of 2010 updated the first wellness policy and required that wellness policies address standards for all foods sold on campus, including vending machines, a la carte lines, and different things like that. A new set of rules came out this summer, which includes you should have policies around marketing in schools. So these are things that can be handled by a separate wellness team, but in Texas, the SHAC basically fits the criteria for the group that should be putting this together. This is what's stated in the USDA rulings. The wellness policies should be developed and implemented by parents, teachers, administrators, school food service, school boards, and the public. And that is basically your SHAC. So the SHAC is the group that should be working on these wellness policies. Some of the things that I think help sell administrators is that it doesn't have to be difficult and it doesn't have to cost them money. Just making some things best practices is what we're looking for as far as a wellness policy goes. Having policies that say healthy options will be offered whenever foods are shared at different school events, so that you're not saying you can't have all of these things. We're just saying that there will also be healthy options. Trying to shift the focus away from food is really critical. Having events that promote physical activity, music, art, those are all positive. When you're looking at fundraisers, I've been to the PTA Leadership Conference the last few years, and more schools are doing things like fun runs and making $30,000, which is way more than they ever made off of candy sales. So when you can show a school administrator that this can actually be a good thing, they become a lot more interested in it. I'm not a big reward person, but if you are going to have student rewards, making sure that they're non-food rewards is the best option. So making extra recess or having lunch with the teacher. There's a lot of different things, and you can find all kinds of ideas and suggestions on the Action for Healthy Kids website for these things. School gardens are big in Texas. nutrition education is part of what has to be built into the wellness policies. How are you providing nutrition education? And these are some of the best practice ideas. A lot of schools, you can work with AgriLife extension agents. You can work with the food bank on taste testing or nutrition articles, different things. So these are just suggestions to kind of get you going and get you thinking how making wellness policies effective without making them a burden. And I think it's easily done. As Sarah mentioned, recess is something that should be discussed and is a mandate for the SHAC. So getting your school to put together wellness policies. Several of the districts in Texas, including Austin, have been implementing policies in the last year. So there's some great samples out there, and let us know. We'd be happy to provide you information around recess. Fitness and brain breaks are great activities. Something, again, that can help your teacher have better control in her classroom and are not a financial burden or a time-consuming burden for your schools. So that was a really quick run-through of some things that hopefully can help you present your case to your school administrators, and hopefully you can use the Texas Department of Ag resource list or visit Action for Healthy Kids to get some additional information. And I'm going to turn it over to our next presenter. And please send questions. If you have any questions, just put them in the question box. Oh, I guess I should unmute you, don't you think? My apologies. Now you're unmuted.
All right. Thank you, Michelle. And good morning. It's certainly a privilege and an honor to have the opportunity to share with you today a little bit about the work that we've been doing through the comprehensive wellness efforts of our School Health Advisory Council. As Michelle mentioned, I'm McKaylee Smith, and I'm the PE Health and Wellness Coordinator for Comal ISD. I work in curriculum with PE and Health K through 12, including off-campus PE, help to coordinate our employee wellness program, Comal Fit, and also get the opportunity to work with our So Healthy School Gardens program. So I'm very fortunate to get to work on many different aspects of coordinated school health in our district communities. Next slide. So before I begin, I want to add the disclaimer that although our SHAC works really hard to further wellness efforts in our district, many of the ideas and programs that we've implemented and that I'll be highlighting today were certainly not originated in Comal ISD. They were created by districts who have proven success in specific areas of wellness that we were struggling with. So I guess that's my first point of advice, as simplistic as it may sound, is find districts that are doing something you want to be doing well and try and find a way to bottle their magic, tweaking along the way to fit the needs of your district. It's my belief that making our world a healthier place for our kids is a collaborative effort, and we are much stronger in our fight together. So with that being said, if there's anything that you see or hear today in my presentation that you're interested in knowing a little more about, please feel free to contact me, and I'd be more than happy to share all that I have to help support you. And of course, if you're a tweeter, you can follow us on Twitter. At Comal Phys Ed covers the student side of our wellness efforts, and at Comal Fit covers the employee side. Next slide. So our district SHAC is composed of parents, community members, teachers, administrators, and district representatives, and we work to advise on all areas of coordinated school health in our district, following the whole school, whole community, whole child model. But this past year, we decided as a council to really focus our efforts in on 4 main areas of wellness that we felt needed the most attention in our district. And one of those areas was our district wellness policy, or FFA local, and our district wellness plan, or FFA regulation. Next slide, please. So some of the reasons why we chose to revise our old FFA local policy was it was very vague. Campuses did not really have a clear idea of what was expected of them in terms of wellness on their campus. There weren't a lot of resources through the old document. It referenced nutrition guidelines and a district wellness plan that didn't really exist. And we wanted the new policy to be as easy as possible for campus principals, sort of like a one-stop shop for information and ideas on different ways to implement various aspects of the policy on their campus. And then lastly, there weren't any measures of accountability. So with the old document, there was really no way to assess progress towards our wellness goals. So as a SHAC committee, we created a subcommittee focused primarily on proposing a new wellness policy and got to work. We started by researching surrounding districts who had recently revised their wellness policies or who we knew had policies we were looking to model aspects of. And I've included a few that were most influential to our work on the slide. We also used the Alliance for a Healthier Generation Model Wellness Policy and the TASB example policy as guides to ensure that our policy was supported by the most up-to-date researched wellness information, as well as adhered to the standard of expectation for our Board of Trustees. So there were two things that we knew we were really going to need to focus in on in our efforts to get a new district wellness policy approved, and that was data collection and the new legal updates, FFA legal updates that were being passed on by the state. So we honed in on the areas of the new policy that we knew may be the most difficult areas of adjustment from the old policy and collected as much data as we could in those areas. So just some examples, we conducted a study collecting district-wide class size numbers in PE because we knew these numbers were increasing exponentially each year. We collected the minutes of PE being offered to students on each campus because we knew that many of our campuses were struggling to meet the state minimum requirement. And then we also put together a mental health task force that conducted a 2-day snapshot to assess what percentage of their time our counselors were free for social emotional counseling in the school day, and then how many students were coming to our 5 district social workers for mental health related issues. So that data collection was really the most impactful in our delivery of the new wellness policy proposal. Just in the mental health study alone, we found that in 2 days, our 5 social workers were seeing 69 different kids for mental health issues, and 13 of which were deemed crisis situations and 6 suicidal. So the data that we collected really affirmed the importance of our work and the need to create a wellness policy that better supported the needs of our students. So after about a year, we were able to finalize a new wellness policy that was research-based, met and exceeded state and national standards, and most importantly, addressed the needs of our students and staff. Next slide. So we tried to be very strategic in the presentation of the updated wellness policy proposal. We knew that in May, our Board of Trustees would be approving the updated FFA legal document coming from the state. So we knew that the board would be expecting some local policy changes to follow. So we plan to present the updated local policy changes at the next board meeting in June. We also plan for our annual SHAC update to the board to take place at that same meeting in June, so that we would make sure to have the opportunity to present the ever important data that we had collected that in turn also conveniently supported the changes we were requesting to make on the updated local policy. So again, we really tried to hone in on the areas that we felt would support the most controversial aspects of our policy. For example, again, we emphasized the fact that the FFA legal updates from the state we're now emphasizing districts' focus on establishing systems of monitoring progress to help support our request in the new policy for campus SHACs that would work in conjunction with the district SHAC. We highlighted BMI data and the research-supported correlation to STAR scores as evidence of the need for nutrition and physical education changes in our policy. And then another example, many of you have probably encountered at some point what seems to be the war on cupcakes at the elementary level. So while we knew under Lauren's law that we couldn't take cupcakes completely out of the school day, we highlighted issues that campuses were having with the amount of cupcakes being offered to students in a given day, and specifically the issues that this posed for students with allergies and diabetes in our district. So with this information, we were able to justify our request in the new district policy for campuses to limit the serving of cupcakes and other junk food for celebrations to the last 30 minutes of the school day. Next slide. So in July of 2016, we were fortunate to have our proposed wellness policy changes approved, and campuses were expected to adhere to the policy beginning the next school year, so this 16-17 school year. The board communicated that they would like for the SHAC to continue collecting data and to provide a progress report of sorts on progress towards our wellness goals at the next annual SHAC report in 2017. So we went to work again, now developing a plan for implementing the FFA local policy through a document called FFA regulation, which clearly measured sort of assessments towards progress on the wellness objectives that we set for the district in the new policy. This document not only guides our work in the SHAC, but it also provides some detailed information and resources for campuses to make the transition into the new policy hopefully as smooth as possible. Next slide. So after creating the district wellness plan, we brainstormed ways to effectively communicate the changes out to campus principals and the community. So we created a checklist sort of categorizing some of the policy changes into areas of wellness, so that in the event principals did not get around to reading the whole policy, they would have a one-pager to reference when beginning to apply the new policy to their campus. We also sent out documents to help support principals in appointing members to their campus SHAC committees, which I'll talk about in more detail in a minute. And then definitely shamelessly plugged all of our wellness efforts through our communications department to advertise aspects of the policy on our district website, social media, and in local media sources. Next slide. So some other resources for campus administration, staff in the community include our district SHAC website that is available on our district website under the community tab. And we really strive through this site to not only house the actual wellness policy documents themselves, but to also serve as an extension of the policy. We hope that the site offers some additional resources through active hyperlinks in the policy to healthy snack ideas, fundraising ideas, etc., for campus principals to have an ease of implementation. The site also offers other just general information about what is a SHAC, how you can get involved, and our district SHAC meeting dates. Next slide. So some of the highlights of our new policy include campus SHACs, which is the most exciting piece for me. So many great things were happening on our campuses in terms of wellness, but we didn't really know about them. So now we have a way to coordinate our resources and to ensure that we're all working together to create more impactful and sustainable change. Some other highlights are the new policy promotes healthy fundraising ideas. So instead of candy bars, our campuses are choosing avenues like fun runs. The new policy also promotes unhealthy food-based celebrations limited to the last 30 minutes of the day, and also dictates that physical activity can no longer be withheld as punishment. Some of the documents that we sent out to campuses to help support the creation of their campus SHACs are included on the slide. These documents came straight from Spring Branch ISD, who are masters in the world of SHAC, and we tweaked them just a little bit to reflect the needs of our district. So you'll see there the SHAC roster for the campus SHAC to help the principal in choosing who should be on that committee, a goal sheet. So we asked that the campus SHACs met prior to our first district SHAC meeting and really brainstormed different aspects of coordinated school health that they were going to plan on addressing this year. And then lastly, just a meeting planning sheet, because we asked that our campus SHACs meet once prior to every district SHAC meeting, and we have 5 district SHAC meetings in a year. Next slide. So some of our future goals as a district SHAC is to continue creating a culture of health. We really hope that health and wellness is embedded in all that we do on every campus and in every department. We ask our campus SHACs at the end of each year to complete the Alliance for Healthier Generation wellness assessment of their campus, and our goal is for all of our campuses to achieve at least the Bronze Award over the next couple of years. And then also we hope in the future to be adding a kids SHAC at the district level. Next slide. So some of our other successes in wellness supported by our wellness policy updates are our employee wellness program, Comal Fit. So this program runs monthly campus-based wellness challenges for employees, sends out a monthly newsletter every month, and sponsors annual employee-only competitions such as the Comal Fit Games at the end of the year. We also have the So Healthy Garden program, currently with 17 campuses and about 1,250 students participating in that. And then something else that we're really excited about is following the Right Bites model from Northeast ISD. We work to create our own Fit Snacks program, which is now offering healthy options at concession stands at all of our high school sporting events. Next slide. So some potential challenges that districts may face in proposing or implementing a new wellness policy, and honestly many of these we continue to battle with in Comal ISD, are in an attempt to create a culture of wellness, you will most assuredly encounter competing priorities. So not everyone may be on the same page viewing wellness as a priority. So my advice to you is to know your audience and find information that they can relate to. So, for example, with campus administration, if healthy children aren't enough to motivate them, then show them the research-based connections between wellness and test scores. There may also be potential challenges with communication, or you may have limited access to your school board or district administration, or maybe you don't have anyone at the district level advocating for wellness. And I encourage you to really utilize your district SHAC and use that annual report as a platform to showcase data and the needs of your district to your board of trustees. So a pretty common hurdle to overcome is participation in low interest in SHAC or wellness efforts. So we've really tried over the past couple of years to work closely with our PTA and encourage campuses to recruit the Healthy Lifestyle Chair as their campus SHAC chair because the efforts are so similar, so we thought why not combine those two? And then lastly, status quo. So people often hold tightly to the things that are familiar to them. So we've sold cookie dough every year. It's what we do. And I encourage you in combating this mentality to continue to present the data. Principals are often motivated sometimes by seeing where their data ranks in respect to other campuses in the district. So using that as a tool, and also just being patient, really focusing on forward progress, however small it may be. Next slide. So here's a flyer that we send out to the community. It has some of our district SHAC meeting dates on it. I encourage you, if you are close by to New Braunfels or San Antonio or the Spring Branch Bulverde area, to come down to a meeting. You're welcome anytime. And again, if you have any questions, feel free to contact me. And thank you again for the opportunity to take a bit of your time today. And most importantly, thank you for the work that you do for wellness in your districts. Michelle?
Thank you so much. I do have a question. Is that lunch down in the right corner, is that from your school meal program, or is that brought from home?
No, it's just a picture that was put together for the flyer. So.
Really, it looks good. I thought, oh man, if that's what their kids are eating, that would be exciting.
But that's what we're striving for all of the lunches to look that way. So
that's some awesome information. Thank you so much.
Yeah.
I'm going to turn this over to Sheila. Give me 1 second to unmute you, Sheila. Okay. Now you have to unmute yourself.
Okay, am I there?
Yes, there you are.
All right. Hello, everyone. I'm just so blessed to be given the opportunity to have the people I work with every day in the district, some amazing PE teachers. But really the backbone of all I do comes from SHAC. I feel like SHAC almost is my boss. SHAC is my partner in crime. SHAC is my everything. We have got some very passionate parents, passionate students, and some great community members on our SHAC. And when you establish a good group of people to work with that have the same passions that you do and give them a sense of purpose so that they can make a difference, so that they can make advancements, you really can get somewhere with your SHAC. If a SHAC is just thinking they're coming to another meeting to check off a box and make a recommendation to somebody and they're not personally tied to it, we don't seem to have powerful SHACs in place if they're not given a sense of purpose. So let's go ahead and look at my first slide there. We have divided our SHACs into 4 subcommittees, and we're averaging about 12 members on each of these subcommittees. And some people say, wow, that's a lot of people in a SHAC committee. Well, we divide them up into 4 different tables, and if you can get 12 people who are just interested in family engagement and community involvement, a lot of times it's our healthy lifestyle PTA chairs, part of that group, our health services and employee wellness group. There's a whole nother niche for the nurses and people who are interested in employee benefits side. Then we have our counseling, psychology services, and social and emotional climate group. And then the group that I'm overseeing this year is the health, physical education, physical activity, nutrition, and environment group that gets together. And so you get to each come up with something that you want to do to move forward this year. What is important to this group in moving this district forward? And so it's just quite humbling to get to work with people who have the same kind of passion that I do. Again, we start off every year doing a comprehensive needs assessment. And when you do that and can figure out where are we at and what do we want to do to move forward, and you get the whole group's buy-in, everybody then is assigned a task. Like, who's going to go out and take pictures? Who's going to do some research on this? Who's going to talk to some principals on this? How are we going to move our idea forward and give everyone a job so that it's not just someone from the district level? So let's go to the next slide, please. To kind of back up and look at how do we really get wellness as part of a policy in a district. The federal law is pretty clear that we have to develop one, we have to implement it, we have to review it, you have to update it. And so our district utilizes our SHAC to advance this. If we will use our SHAC in a way that they are almost, I want to say, like employees of the district. They're not, but you know, you have to have 50% plus parents on your SHAC or community members that aren't part of your district, but you make them feel like they are part of the district because they are making decisions on behalf of the district. They feel more valued. I would say that our SHAC this year probably consists of about 80% parents, students, and community members. But the key figures that are on our SHAC would be our director of our child nutrition, myself, who is over health and wellness for the district. We have someone there from HR. We have the director of counseling services. So when you put some powerful administration people as part of SHAC, then when recommendations come out of SHAC to principals, to the school district, it has some more clout to it because you invested some time and some good quality people in putting the recommendations together that come out of SHAC. Next slide. So just to go over the basic expectations and policies, we expect that each campus principal is responsible for implementing their FFA local, the wellness plan, at their campus level. And then again, at the district level, we have myself and the child nutrition person who is supportive of those campus principals and giving them the tools that they need to implement the wellness policy. Any questions that they have, they generally have us to be able to contact. So it helps if from the get-go, your SHAC has people that are at the district level that can help support those principals, and they feel like they can lean on should they have any questions. For example, our hiccup a couple of years ago was the whole Lawrence Law and the cupcake issue. And we've set a policy that said no food or beverage of any kind will be served during the school day as part of a birthday celebration. So what we try and do is support the principals as to what that looks like. How can you can't prevent the food from coming to your school, but maybe we put it in a Ziploc bag and we send it home at the end of the day. We have celebrations, as our last speaker was talking about, in the last 30 minutes of the day to be able to distribute the food. And really in giving the parents other options besides food to think outside of the box, providing principals with that support is just huge in passing that on to the parents. So that's our biggest support, is getting the information to our principals so that they can turn around and support the decisions that our SHAC has put in place. Next slide. So getting information to the school board. We have an amazing school board, a very passionate school board who is interested in health and wellness, who realize the benefits of advancing our school district through our health and wellness policies. We have a superintendent who is amazingly supportive over health and wellness decisions because he understands that advancements in health and wellness will better our academic scores, will lessen our absentee rate. And so when you have promoted it in a way that the people on the board, your superintendent, your administration, understand the basics behind it, it's a lot easier to make things move forward. So our SHAC prepares an annual report every year that we give to the school board. We do that through what we call our IST team, present it to them, and they are the ones that give it to the school board. Any questions that they have, I think we have a direct communication line between the school board, myself, other people of the district, and certainly our SHAC, who do not hesitate to pick up the phone and talk to our school board and answer any questions that they have. So just establishing that open lines of communication has been huge. Our SHAC feels like they can go to any campus to gather information. Our SHAC members, last year we assigned each SHAC member a school that they adopted or responsible for going out and gathering information from what we call whole child committees on every campus, and from the principal as to what the needs are for each campus to bring back to the SHAC to make sure we were meeting the needs of all of our campuses. We have a challenge in Frisco ISD and a blessing at the same time that we are a very growing school district. We have 40 elementary schools, 15 middle schools, and 9 high schools, adding more schools every year. And so it becomes more and more challenging to stay connected with all of these schools. And unless you have a representative from each campus that can report back to the overall SHAC, can we still feel like we stay connected and support the principals in the jobs that they have to do every day. So again, a lot of our schools have focused their efforts on big events that they're doing out of their school, from a physical activity event, a health and wellness fair, making part of the PTA meetings. When the PTA meetings happen on campuses, can the Healthy Lifestyle Chair have 5 minutes to introduce a health topic or bring some information to the parents? That's been, just huge. And of course, like our last speaker talked about, we do use the School Health Index Survey, along with many of the assessments that we push out through our district through our Google Forms to gather information, and that we turn around and submit to our school board so that they can stay informed about all we're doing and, keep a pulse on what their district is up to. So that's kind of where we go with our getting support from principals, from our school board, and our superintendent administration, is you have to involve them through communication constantly. You have to find out, as our last speaker had said, is find out how to relate to them and find out what's important to them and what's a priority to them in order to fit health and wellness in. Because everybody would agree it's a priority, but on the list of priorities, let's just make sure it stays on the top and helps them in meeting the priorities that may be top on their list. So that's all I have. I guess I'm open to questions at this point.
Thanks, Sheila, so much. That was a great presentation. This PowerPoint will also have some links to different SHAC resources from the new revised SHAC guide that the Department of State Health Services put together, information on the school health programs that have been approved by Texas Education Agency, Texas PTA Healthy Lifestyles. We have a great new volunteer chair, Karen Burnell from Dallas, and she has a monthly newsletter and some great resources on their website. Then if you're interested in wellness policy information, there is information on the squaremeals.org, which is from the Department of Agriculture. And of course, as Sarah mentioned earlier, the It's Time Texas website is hosting a page for us at itstimetexas.org/SHAC. And then the actual laws that apply to coordinated school health can be found at TEA. So we will send this PowerPoint as a PDF doc along with the link to the recording, and then we will also send any resources or any other information that we have that might be useful. There's some additional resources. As she mentioned, Spring Branch, we have had them on a SHAC webinar previously. So this PowerPoint also includes a link to their resources. So hopefully that will be very useful to you, as well as information from CSPI, which is the Center for Science and Public Interest. And they've done a lot of work around healthy vending and healthy food and beverage environment. So these are all great resources for your School Health Advisory Council. Now, let's see if we have any questions. If you haven't put a question in and you have one, please enter it. I have a couple here. One of them, I think we can, hopefully that Spring Branch link will help, but we're wanting to know if the forms that you used for your CSHACs would be available, and if there was any way we could send those to the people on the webinar. McKaylee, is that something you could share with us?
Yes, absolutely. I can share it with you, or anyone who's interested can just shoot me an email and I'll send them to them directly, either way.
Great. And I think this is one for both of you. What are you using on a district level for needs assessment? What are you using? Are you using School Health Index, or what are y'all using for needs assessment?
I can go ahead and answer that one. We have a campus needs assessment is what we call it. We use very similar to what they use at our district improvement teams, and can send a copy of that out to help people gather information. So I'll send that to you, Michelle, and you can get that out to everyone.
Awesome.
And we are using the Alliance for Healthier Generation assessment and seeing how that works this year.
Okay. I can tell you Action for Healthy Kids website has now got a modified version of School Health Index, and we're working on a district version, so that right now you go on and the district can fill out part of the information, but then the schools have to actually input their information as well. But hopefully and I think the Alliance has a similar structure where you'll be able to input it online, and then you'll be able to track from year to year progresses and weaknesses. And I think that'll be a really good way to update your wellness policies if you use something like that. This is one, I guess, both of you as well, and I don't have an answer for it. This is something that came up at the last wellness team training I brought. How do you confirm campus compliance? One of the things about the new wellness policies is that you have to, show how it's being implemented, and that's basically going to happen at the campus level. do you have forms, or how are campuses letting you know that they're in compliance with the wellness policy?
Sheila, I'll let you go first.
Okay. Okay. First of all, the principals are made aware of what they are to be in compliance with. And when they understand, it comes from the director level that these are the policies of the district, we really don't have a problem with them following the policy. Sometimes they're just unaware of a new policy, and so to make sure you communicate that well and they understand what it's all about, it's easier to get them to comply with it. It's not really a gotcha that we're out checking to see if you're complying with it, because it's just a given if it's a policy in the district that they comply with it. And so we haven't had much of a problem with that.
And I would agree with Sheila. The only thing I would add is we are using our campus SHACs to help just sort of monitor and stay connected on progress towards goals for each campus, and then also using that assessment piece at the end of the year to really show us where each campus is on their wellness journey, if you will.
Okay.
And I guess I would also add, in the House Bill 5 accountability rating system, it's built into there what the expectations are. And so, that's put before them every spring as they go through the accountability rating system.
Okay.
Yeah, good point.
How do you successfully recruit SHAC members?
That's probably one of the easiest questions. I always get asked that. I tell you, we get flooded with people who want to be on SHAC. Our SHAC is probably over 50 people right now, and it seems amazing, but it starts with your American Heart representative would want to be a part of it. There are parents on every campus that are passionate about health and wellness. How do you find out who those are? There are, every parent cares about the health of their child. And so to let them know what SHAC's about, sometimes we don't advertise what SHAC's about enough so that they don't know to get involved. They don't know what it's all about. And who wants to sign up for a committee that you may just be taxed to death with work, so you don't ever approach it? You think it's a district big meeting that gets together and you don't know what all they do. So until you get out there and spread the word and form some friendships out there. I mean, partnerships is what Frisco ISD is all about. We have some great people from the Dallas Cowboys serving on our SHAC. They are part of our school district. So we involve businesses, parents, and students. And once they're aware of what we do, we just have them flooding in the door. It's awesome.
That's a wonderful.
Yeah.
Go ahead.
I'm sorry. I would agree. I think the biggest hurdle to participation is just communication. What we've found is that many people in the district just truly don't know what SHAC is or what a SHAC does. So in working with the PTAs and getting that message out about what it is, as Sheila mentioned, you'll be surprised to find how many valuable resources you have on your campuses that are interested in getting involved.
I would agree. I think a couple of things we've done is we've put a application form online and a good explanation of what is involved, what a school advisory council does, so that there's a clear understanding what we're asking for and how much time it's going to take. I think that's critical. One of the other things is, depends on when you have your meetings, how easy it is to get people to attend. One of the problems I've seen over and over at some districts is they have the meeting at a time where it's convenient for school personnel, but parents can't come. So if you're having a SHAC meeting at 3:45 in the afternoon, likely most of your parents are going to be at work and they're not going to be able to join you. But then if you have it in the evening, you miss out on some of your school personnel. So you have to just kind of figure out what works for your district to get the people there that you want there. And we also have our meeting at our school board meeting at our school board room, which adds a little prestige. If you get some of your community members involved, some of the doctors, some of the people in your community, that's something else that makes other community members want to be a part of it or want to join as well. So just look around and see how you can make it easy, see how you can get some of your local leaders engaged. And we also have a school board member that sits on our SHAC. They don't vote, but they participate and attend. And that makes it a lot easier to get information to our school board, as well as makes people more inclined, parents especially, to want to come because they know they're going to possibly have access to a school board member while they're there. So that is our last question. The presentation will also give you our contact information. Feel free to reach out to any of us directly with any specific questions, and I'm sure all of us will be happy to answer you. I want to thank our partners. We have a committee with Action for Healthy Kids that includes AgriLife Extension, Dairy Max, It's Time Texas, the YMCA, Tayford, and partnership that has worked for the last several years on putting together information and webinars for School Health Advisory Councils. So we hope you found this informative and helpful. And Amy, we will email the slides out as well as a link to the webinar. I just got a quick question about how would you get the slides. So we will actually send you a link to the audio if you feel it'd be useful for you to share the webinar with others. So thanks for your time today. Have a great rest of the week. And I hope you all have very successful School Health Advisory Councils.